Okay, welcome everyone. Thank you so much for joining today. I'm Alex Wesley. I'm the Director of Marketing for USTA New England. We are recording the call, so I ask that you all stay muted throughout the interview for that reason. And I'd like to thank our exclusive orthopedic partner, Sports Medicine North, for hosting this interview with us today. We'll include information and a link to their website in our follow-up email to you all. Thank you to those who submitted questions. We had a lot of great questions come in from the registrations, and many of those questions will be addressed today. As a heads up, the chat feature is off during the meeting, so please feel free to just sit back and enjoy the conversation. I have the pleasure of introducing our guests today, Dr. Bojan Zoric and James Maimonis. They will be talking injury prevention and issues closely associated with common tennis injuries, which I'm sure everyone on the call has had at one time or another, including myself. Dr. Zoric is a board-certified fellowship-trained orthopedic surgeon in the Boston area, specializing in sports medicine and treatment of athletic injuries of the hip, knee, and shoulder. He's an expert in repair and reconstruction of cartilage, ligaments, and tendons, and in arthroscopic surgery, I hope I said that right, of the hip joint. He's a team physician for the U.S. Women's National Soccer Team, and he's also an active member of the U.S. Ski and Snowboard Association physician pool. Our interviewer today is James Maimonis. He's our manager of media and communications here at USTA New England. He's an experienced communication professional who's been conducting interviews for more than 10 years, if you can believe it, James. It's been a while. He manages all of our USTA New England communications channels, as well as USTA.com and all of our social media platforms. So I'm excited for this conversation, and with that, I'll pass it to you, James.
Excellent. Thanks, Alex. Appreciate it. And thanks again, Dr. Zoric, for being here. Injuries are obviously super hot topic, especially in tennis. And we've got a lot of players on this call who are really interested. So we really appreciate you jumping on and addressing some hot button topics for them. So first of all, as a player yourself, and a pretty good one from what I've heard through the grapevine, tell me some of the most common injuries you see on a day-to-day basis.
First of all, thank you for having me. It's a pleasure and an honor to be here. And yeah, hopefully I can give some insight, both personal and professional, as far as to how to prevent some of these injuries. So by far the most common injury that we see in recreational athletes, and this goes in most sports, is soft tissue or muscle injuries. These are injuries that usually happen in younger patients, mostly due to overuse and repetitive use injuries, and in include myself, older or recreational athletes, probably because of lack of preparation, lack of stretching and preventative measures, and usually significant time constraints. And so people just go into playing sports directly without having any warm-ups, any stretching exercises, any preparation for their recreational activities.
Sure. So I bet you see a lot of tennis elbow, rotator cuff. What else do you see generally?
We see a ton of, specifically to tennis, we see gastroc or calf strains are very common injuries. More devastating injuries are something like Achilles tendon tears. We see a lot of other muscle, quad, hamstring strains and muscle injuries that are not infrequent. And then unfortunately, we see more, serious injuries such as ligamentous injuries and meniscal tears in the knees, rotator cuff tears of the shoulder. But usually those tend to be less frequent, fortunately, and not in tennis, not as common.
Okay. So talk about some of the preventative measures, because that seems to be the issue. So.
Well, 100%. I'll start with, if you look at, the high level athletes, they spend an inordinate amount of time preparing their bodies and going through preventative measures. For 11 years, as was mentioned, I used to work with the U.S. Women's Soccer Team, and the athletes on the team would train and practice soccer for 2 hours a day, maybe. They would spend 6 to 8 hours doing, yoga, therapy, strengthening, any kinds of preventative measures or exercises to maintain their bodies. Now, I don't expect us, normal human beings to be able to do that, but it is strange, and we often see that the opposite happens. As we get older, we probably need to spend more time on recuperating and rehabbing our bodies, and with time constraints, family constraints, work constraints, what happens is you actually spend less and less time on yourself. And so the biggest thing that I think people can do that can help themselves is make sure to take the time to warm up, stretch, and do a reasonably good 10-15 minute warm up before any activity. And then subsequently, if there is any chance, once you're done with the activities, stretch, cool down, and rehab, and do some exercises to help with strengthening and prevention. And we can go through some of sort of very specific or types of exercises that includes.
Yeah, I was just going to ask, what are some of your favorite stretches or exercises pre or post match, and some of the most effective you think?
And so I'll preface this with, I'm very good at saying what should be done, and I'm less good at doing this all the time because, again, time constraints. Unfortunately, it's very common. You come in 2 minutes before a match, and my warm up includes basically taking my racket out of the bag and taking my sweatshirt off, and so a simple sort of 10-minute example of a warm up would be starting very easily to do some dynamic motion and stretching exercises, warming your body up, starting with simple, if people have access to a jump rope, doing some jumping jack type exercises for 25-30 seconds at a time, getting the heart rate up and starting to get muscular motion going, doing simple stuff like sideways lunges to do some stretches, get your quads, your glutes starting to work. And these exercises are important that they're done in a very controlled and gentle manner to begin with. They're not supposed to be explosive. They're supposed to warm up the muscles and gently stretch them. Doing some simple, shoulder rotator cuff rotational exercises can be helpful to warm up the shoulders. And then doing simple shadow movements where you can almost mimic the motions or strokes that you're going to do in tennis, overhead serving, backhand motions, forehand motions, where you're in a controlled or slow environment, getting your joints and muscles warmed up. Those are some very simple, easy exercises. On top of that, high knees, butt kicks, where you start getting your quads, you're starting to get your body warmed up. Those are simple and excellent exercises. And pre-matches important exercises, because dynamic motion stretches have been shown to be more effective than static stretches in warming up before. Static stretches are better probably in cooling down and doing stretching post-exercise routines.
Interesting.
Does that make any sense?
Yeah, absolutely. Yeah. Well, that's great. And how about to ensure you prevent injury during a stretch or during a warm-up? Do the more dynamic warm-ups make it easier to stay off the injured list, or
I mean, they seem to be more effective at getting blood flow and stretching for muscle activity and pre-activity. Now, that doesn't guarantee any injuries. I wish we could figure out how to guarantee we have all our athletes never get injured. That would be fantastic. The important part is not going too hard and overstretching, and then really listening to your body. These should be well-controlled stretches. These are stretches where you're in control, in balance, and there should be no strain or discomfort as you're doing them. So if you're doing high knees, simple, you don't have to bring your knee up to your chest. If you put your arms sort of down at hip level, you should be able to bring your knees up to that level. Same with high kicks. You're not trying to kick your butt as hard as you can, but just getting that motion, gentle muscle movement and repetition going to warm up and get those muscle fibers to get oxygen, get blood flow, and start stretching a little bit.
Sure. And is that generally the case for across the board in terms of age, or younger kids, maybe older people? Should they modify that in any way?
I think it's actually important in all age groups, but we probably need it more as we're older because we get stiffer, we become less flexible. We don't recover the way we used to. Up until a few years ago, up until last year, I played old man soccer, and my recovery started getting into from Sunday games, Tuesday, Thursday. By the end of my quote unquote soccer career, I was hurting already. Before I even started the next game, I was still in discomfort.
Yep.
I think younger kids, it's important to do these stretches. It's important to do all of these exercises. The bigger part we see with younger athletes is actually the opposite, and that's overuse injuries. We see people who, a typical example is high school or middle school pitchers, baseball pitchers. There are clear regulations as to limitations of throws that those pitchers should do. Same with tennis players, that overhead serving motion is a very forceful and very powerful motion. So you can overdo and you can get repetitive stress injuries and overuse injuries in these young athletes because they can, for better or worse, usually play, hours on end, days on end, tournaments that are extensively, and we often see repetitive overuse injuries in these younger athletes.
Yeah. Is that what you tell parents and coaches really about their athletes and to make sure they prevent them? Is that the main thing you'd let them know?
Absolutely. I think it's really important not to stress, especially children in age groups where their growth plates are still open, that it's really important to give them a chance to recover, that it's important to give them a chance to have days in between where they cross train, where they rest, where they give their bodies a chance to recuperate and build back up.
Sure. What if you feel like you have an oncoming injury or something that you feel could get worse if you play, but you want to play through it? You've got that competitive spirit. What are some signs maybe that you have something that might get worse, or what would your advice be to people?
I mean, I think I call it, there's two parts of pain. There's muscle soreness, which is after working out. I usually refer to that as good pain. That means sort of we've exercised and there's some discomfort, and most people are fairly comfortable and know what that is. Then there is a slight difference in this sort of sharp, noxious pain. And if you ever start seeing any sharp pain and that pain profile is getting worse and worse as you continue the activity, I'm a firm believer our bodies know better than any of us, even specialists know. I say this to my patients all the time. If you have a bruise and I keep poking that bruise constantly, you're only going to aggravate it and make it worse. And so if you see that profile progressively getting worse, it really makes sense and behooves you to stop that activity, to really take inventory and potentially even be seen by a therapist, a specialist, somebody to make sure that you can sort of nip it in the bud and address it before it becomes a problem.
Sure. Are there certain injuries that you should more so be stopping that you see might be oncoming in terms of parts of the body, and some that you could play through?
I mean, that's a tough question, and I'm not sure exactly how to answer it. Yes, I mean, I think, again, muscle soreness and sort of workout pain is often something that I think is fairly benign to play through if you can. Muscle strains you have to be worried about, because if there is a sharp pain and you have, I'm going to take the example of, you have a little tear. If you take this piece of paper and there's a tiny little tear, if I strain that and pull that further, you can progress that injury and make it worse.
Sure.
How to know exactly which one is which is really difficult, and that's where sometimes people misread their body, and it can be very challenging and difficult. Sure. to understand that.
Great. Yeah, that's great. With that said, at what point do patients, or should patients, generally come to see you to assess an injury like that?
I mean, I think it's anything, as knowing this personally, as I get a little bit older, everything starts hurting. It doesn't take a lot nowadays for me to start having some mild muscle aches and pains. If they're short limited and they last for a day or two, and this is something that goes away, I think that's normal. I'm going to call it age-related and normal sort of activity-related discomfort. If you see something that is ongoing and is not getting better, and as I said before, progressively getting worse, I do think there is a value in seeing somebody, a therapist, an orthopedist, even the primary care physician, to be evaluated to make sure, because a lot of times those type of injuries, if you go into physical therapy, if you go in and address it earlier, you can prevent further and more damaging injuries.
Nice. Okay. So you're a surgeon, but I know most of your patients you don't perform surgery on. Most of it's kind of assessment and seeing where they're at. What's a normal patient doctor kind of communication like when they first come and see you, and what do you usually talk to them about?
Yeah, absolutely. I mean, as surgeons, we try to avoid surgery, but that's sort of the final option. And there are certain problems that obviously necessitate surgery, but a lot of things, if we can catch them early on, we can prevent surgical intervention. So most of the time a patient will come in to see us in the office. Let's, for example, say knee pain, they'll come in, they'll be seen, we will hear the story, what's been going on, what's bothering them, what aggravates it, what makes it better, what makes it worse. We'll examine the patient, often get an imaging study in the office, like an x-ray, to make sure there is no bony structural problem, to make sure there's no arthritic changes in the joint. And then based on that, really, we would sort of discuss treatment options, and in big categories of treatment options are, is this something that is muscular? Is this something that we can rehabilitate and put them into physical therapy? Was there an acute injury or something that worries us and necessitates further imaging? We could order an MRI or something of that nature to look at the structural components of the knee in this example, or what else is going on. And then there are options where we can provide symptomatic relief between anti-inflammatory medications, between injectables. If there are things that could benefit from these pain relieving modalities, we could offer those and help patients. And so that really is a typical visit, assess the patient, get the imaging and information studies that we can get, and then based on that, try to direct the patient based on their injury, based on their findings, what's their best treatment plan. And
Sure.
It's really an interactive process, because some patients would prefer to do X, Y, and Z before they do this. And so it depends a lot on A, the findings, B, the patient's goals and time frame.
Great. And in the worst case scenario, in the case of a surgery, what's generally the recovery time for people who might not be familiar, say for an Achilles tear, say for a rotator cuff tear, tennis elbow, common injuries like that for tennis players?
So they can vary dramatically, but those two examples that you've spoken are and this is why it's so important to see people early on. Rotator cuff injuries and Achilles injuries have a really long recovery process. So we're talking about six plus months until people are fully back to sports. They can be there's soft tissue or tendon injuries that need to heal back to bone and need to heal back. And those injuries can be really prolonged recovery processes. And so, muscle strains within 4 to 6, sometimes 8 weeks that people can get back to their sports. Tendon injuries such as ACL, ligament injuries such as ACL ligament injuries, Achilles tendon tears, rotator cuff tears. If they need surgery for those are not insignificant recovery processes, and we're talking about 6+ months before people are back to doing any sports.
Sure. What do you say to the sidelined athlete who's just so eager to get back on the court? What do you say to them? Give them a little peace of mind.
The important part is that if they've gone through a surgery and they're sidelined, you can make it worse. I mean, unless I tell my athletes, be a little selfish. I know they want to get back to the game. I know they want to, if they're part of a team sport, they want to be part of the team, but the only person who pays the consequences is ultimately them. And so
Sure.
If you go back too soon, we see more, terminated careers, young careers. We see more young patients that have tried to play through injuries and have consequences that eliminate them sort of progressing in their athletic careers than the opposite. So I really think people need to take time and recover fully before they return back to sports.
Sure. Great. That's great advice. What are some common misconceptions you see when it comes to injuries, whether it's commonly mislabeled injuries or recovery or warm-up routines that might work but aren't as effective as people think? Or is there anything that comes to mind for you that you hear a lot and you just say, no, that's incorrect?
Yeah, I mean, it depends on different age groups. I would say in the younger age group, I see a lot of, a big narrative of Tiger Woods is an example of a story of a person who just was pushed by their parents, played these incredible amounts of golf and happened to become, arguably the best golfer in the world, right?
Sure.
I would say that he is more of an anomaly than the norm.
Absolutely.
That if you have people who are pushed beyond pain, and especially our younger athletes, we see the opposite. We see stress injuries, we see overuse injuries. And so I think it's really important to listen to the body, listen to the athletes, give athletes of all age groups a chance to recover. Our bodies need that time, and really work on the recuperation. Yeah, those are probably the things that are my pet peeves when I see patients being pushed, and especially the younger patients, by their coaches or parents or older sort of figures, that they get told that they have to push through pain. I do not think that's a I think that's a bad way to proceed.
Sure. Sure. And how about when you're out and about in your day-to-day life? People know you're a surgeon, they know you're a doctor. I'm sure you get countless questions, friends, family, everybody that you interact with. What are some of the common questions that you get, and how do you generally react to those in the real world?
I mean, yes, that happens all the time, and sometimes it's very simple questions. You know, I felt a twinge here, a twinge there. I'm icing it and taking ibuprofen. Anything else I should do? A lot of times I get sort of really questions. I had this injury and I'm having all these symptoms, and it is hard to make a determination or diagnose a patient sort of in a coffee shop or you know, the bagel place as I'm holding. I honestly think if people are worried and have significant, you know, questions, that the only real place, the reason we have office visits, the reason we have these imaging modalities, because it gives us more information, more valuable details where we can direct patients' care and diagnose them more accurately and hopefully get them on the right pathway. So a lot of times I try not to give, you know, not clear advice. And I try not to be very specific if I don't know exactly what's going on and can't give them a specific diagnosis.
Sure. Okay. And how about you personally? You've been, I know, a tennis player, a little late to the game, but athlete your whole life. What are some tennis specific injuries that you've had or you've experienced?
Oh, absolutely. Everything. No, this is
I don't want to hear that.
This is the part of being, I'm good at preaching all these things and less so at doing them, just because, you know, I'm late at work. I have a family at home. I show up again 2 minutes to the game, and I know I should be better at doing all these things. But the biggest part I've been dealing with probably for the last year is Achilles tendonitis and my calf problems, and it's something that has been repetitively recurring, and we see this very frequently. If I don't do my stretches, if I don't do my warm-ups, it will come back. I have been diligent for once about doing them over the last several months, and I've had really no issues. I take the time where on days off in between, I'm stretching, I'm doing my Achilles exercises. I sometimes sleep with this device that keeps my sort of Achilles stretched, but they have helped and they work, and it's amazing when you actually put some effort and time into it, how effective these things can be.
Excellent. Did you have any, as a soccer player growing up, did you have any soccer injuries that have translated or worsened from playing tennis, or are there any that you've had and that you've prevented by switching over to tennis, either or?
I definitely had, unfortunately I was built for chess rather than soccer growing up, and so now I've had, you know, I broke my ankle, I broke my foot, I had knee surgery growing up, so I had plenty of surgeries. Fortunately, I don't have, or I'm not feeling any significant consequences from those specific injuries. More so, I think that I as I've gotten older and I don't spend the same amount of time in the gym, rehab, strengthening, as I was playing, I just noticed myself that I was not in the same shape or condition that I used to be, and I felt like I was putting myself at more risk and getting more injured. I do think that switching over to tennis has helped in that sense, in the sense that I don't have somebody coming out to tackle me or it shouldn't happen in tennis. I'll occasionally get hit by a ball, but it's not the same thing. I still think that it's an explosive, dynamic sport, and I have to be really good about doing my exercises, especially for me, the Achilles and calf stretching and strengthening exercises, but even shoulder exercises, so that this does not flare up.
Great. And on that topic, we did have one question submission. Someone asked about an LCL sprain that they had years ago playing soccer. They're wondering how they can prevent that from re-aggravating, reappearing while playing tennis.
I mean, number one, hopefully, if it was years ago, the LCL has scarred in and should be healed at this point. So the biggest thing for all ligament injuries is you can strengthen the supporting structures, right? So if you build quad strength and hamstring strength, those muscles are going to support the knee substantially. So when you are doing your cutting, pivoting, you know, changes of direction, quick start and stops, having that muscle group or those muscle groups firing and protecting your knee, that's by far better than any brace, any structural external device that we can apply or give. If you can work and continue building those muscles up, they will be protected, and that's honestly the best protection that somebody can probably do.
Great. And along those lines, we had another one too regarding the ACL, and they asked if a partially torn ACL will eventually and can eventually tear all the way.
So the answer is yes and no. So it depends. So most of the time, if you have a partial tear that's less than 50% torn, a lot of patients can be treated conservatively. And if those fibers are still intact, the ACL will scar in and heal to a point where it is structurally sound, and people have gone back to college, high school, even professional sports. If the ACL is more than 50% torn, and people have feelings of instability, that the knee is unstable, a lot of times that will eventually fail and could cause problems. And so there's a big distinction of how much of the ACL is torn and how well it has healed in, and that can really depend. Those nuances are important because the outcomes can depend on that.
Okay. Are there other injuries that you see a lot that aren't really as well known to the common athlete, that they might not hear or think that they have, but as a doctor, you see it a little bit more and have more insight on?
I mean, from a sports medicine perspective, we've touched base a lot on some of the biggest thing I see again on tennis players are lateral epicondylitis or elbow injuries. These are not necessarily injuries of trauma, but repetitive tennis motions, especially because you're swinging your racket, you're sort of using your upper extremity arms. Those can be really nagging and sometimes disabling injuries that can keep people out of sports, and are these almost frustrating injuries because they're not a terrible injury such as an Achilles or a rotator cuff or an ACL tear, but they can be substantially limiting and bothersome that they keep people off the court. And all tendinitis of that nature are the same, whether it's Achilles tendinitis, whether it's elbow tendinitis, or lateral epicondylitis. These are injuries that people sometimes blow off, but they can turn into very disabling and uncomfortable situations where they cannot return to sports.
Interesting. Okay, cool. Switching gears just a little bit. Growing up, I was a big Goran Ivanisevic fan. I know you're Croatian. A lot of us in our 30s were big fans of him growing up and his serve, and one of our favorite players. So I just wanted to see if you had any Ivanisevic stories and memories from watching him.
Yeah, so obviously Goran Ivanisevic in Croatia is a tennis god at this point, and I think he can do no wrong. He was an incredible athlete, an incredible player. My dad is from Split, which is actually his hometown, and when he won Wimbledon, they had a celebration for him, and there's pictures of him by the seaside promenade in Split, where I think the entire city was shut down. Everybody was there, and at the end of the celebration, I think he had celebrated quite a bit and was a little under the weather, and eventually basically he and a bunch of the fans just jumped into the ocean as a continuation of the celebration. But that was the type of person and player he was. He was just this super charismatic, super dynamic person, and very interesting person.
Excellent. Cool. Well, I heard you also had a killer drop volley through the grapevine. Just might have heard that. How do you as a surgeon have in such a rigorous schedule? Obviously, how do you have time to play tennis and still play soccer recreationally? How do you balance that?
I think it's hard, but I think it's also necessary, because those are a little bit of my outlets, and I don't know. I find that actually I'm more functional when I get the weeks when I get out and do those exercises and do the things that I enjoy. Skiing, soccer, tennis, whatever it is that I'm doing, it's those few hours where you turn off your brain from whatever daily work activities or life or stress that you have. I think those are really important. They recharge you more than I think people give it credit for. So I actually find I'm more efficient. I'm in a better mood. I'm usually, especially if I win, happier if I play tennis or play these sports. When I lose, less so. But It's
So
still,
how often are you happy?
depends. Yeah, I do
Just
okay,
kidding.
but not as
It's not
much as
about
I'd
winning
like
or losing.
to. Yeah.
Nice. Well, you touched on this earlier, but another question we had goes back to overuse in juniors. How can a junior player themselves or a parent or a coach detect that the player has been overusing a certain muscle or a certain part of their body? And then, what could kind of set that off?
Well, it's hard, and I think ultimately the only time you start detecting is when it starts creating a problem, right? When you start having pain. But those are important signs to follow and understand and stop playing through pain. The biggest part is prevention, and this is where having coaches or leaders that sort of control the amount of exercise, cross train, and don't just can't sit there and do 7 days in a row of 200 serves as hard as you can. At some point, that's going to create repetitive use injuries, and I think good coaches and good training sessions can be set up where you are doing tennis related exercises, you're doing something that can always benefit you and forward you in your sport, but it's not the forceful, high, energy, high momentum service exercise every single day. And so it's a team effort, and I think it's young players don't know when to say no, especially if they're gifted and they're driven because they want to excel and want to proceed. And I think it's important that the parents and coaches are there and recognize and try to pull back and make sure that they're getting their rehabilitation, their time for rest, and their time for recovery.
Does diet and nutrition and sleep have anything to do with that, or is it mostly on the court, kind of independent of everything else?
No, I think there's good studies that in high level athletes, I go back to soccer because I spent many years in that world. A lot of the professional soccer teams, they have sleep monitors and they require their athletes to sleep, 10 hours a day. They take naps in the middle of the day because their injury rates decrease, their performance levels have substantially increased, and equally diet's hugely important. I mean, I think again at the highest level, you hear Djokovic, you hear Tom Brady, you hear all these things. There's not one diet that I know that is sort of better, but I think a regimented and healthy diet's important. In the recreational athlete, I think everything in moderation. A moderately healthy diet's important. Smoking's bad, alcohol is bad. Yeah.
Excellent. Okay. And another question that we got, it's about recurring muscle strains and tears for somebody. They said in their quad specifically, from a lot of sprinting and activities like that. What would you say to something like that about how to maybe help that in the future?
I mean, those are tough injuries, and the biggest reason people get recurring tears are they honestly don't give it a chance to recover, because muscular injuries usually take at least 6 to 8 weeks to recover. Even once they heal, the muscle heals with scar tissue. So if you think of it, normal muscle is fairly pliable, it's stretchy, whereas scar tissue, just like if you cut yourself on your hand, you get that scar. It's fairly thick and dense and not flexible at all. And it takes a while for your body to regenerate that scar tissue, make it more flexible. And so if you go back too quickly, and if people haven't recovered fast or significantly enough, it is very common to have recurrence of any muscle type injuries. That is something we see very frequently.
Yeah. How about with tennis elbow and other injuries similar? What do you think about cortisone shots? Some people tend to get them. They work for some. They don't work for some. They make more. They cause more pain. What's your take on cortisone shots?
I mean, I think cortisone in certain situations is a modality that we use to help decrease inflammation. It's not a magic bullet. It doesn't rebuild or regrow anything, but it is one of the strongest anti-inflammatories that we use. So in repetitive tennis elbow, if physical therapy is not helping, if bracing or strapping is not helping, cortisone injections can be very helpful and can really decrease the inflammation. Sometimes they're just temporary. but a lot of times they can really help calm the inflammation down. I use this example all the time. Have you ever bitten the inside part of your cheek?
Oh,
You know,
yeah.
when you bite it and you keep re-aggravating it and retouching it and biting it, cortisone is the effect of it. You can calm that inflammation. When you finally take the effort and say, okay, I'm not going to bite it anymore, and it gets better, cortisone decreases that inflammation, hopefully gets you to a point where you can start at a much less inflamed area, and it can help benefit those tendons, that muscle to recover. There are things that it's good for. There are things that it's absolutely detrimental for. And so it's really important to know when to use it or not.
Okay. What are, I guess, are there different common injuries between kids and older people? Is there one that's more common in younger folks and one that's more common in older folks in terms of tennis? Or is it generally similar across the board?
No, it's very different. You know, rotator cuff tears don't happen in people under 50, basically. I mean, it's very uncommon to see unless they've had a severe trauma. So rotator cuff arthritis only happens in older people, right? Or mostly happens in older people.
Sure.
Tendonitis is something that is across the board, but more, you know, muscle injuries and strains are across the board. But rotator cuff tears, arthritic changes, those are things that we see much more, only really in the not elderly, but older population. I don't want to call myself elderly.
You're not. don't worry about it. And then we had one more too about lower back pain or disc problems, and if it's related, if not, neck injuries and neck pain. I don't know if you can address either one independently or together.
Yeah. I mean, this is unfortunately something that probably all of us are going to deal with at some point in our lives. You know, when you look at back imaging studies, even in asymptomatic patients. So I'm 48, I think. Yeah, 48. I have fortunately no pain in my back at this point, but I promise you, if we got x-rays of my back, there are going to be changes and degeneration from, you know, 40 plus years of soccer, from being the active person that I have been. And so back pain and disc problems are something that are really tough. And that's one of those things that, again, rehabbing, strengthening your core, working on the muscle, supporting those areas, especially your lower back, is really helpful and beneficial. There are times where that's not adequate, and people have gone through injections that can be helpful. And then, you know, even worse cases, there are times where our spine surgeons have to do, you know, surgery to try to really get people. But that, again, is usually the last option, and we really try to prevent that if possible.
Yeah, I mean, lower back pain is so common. Are there some stretches or warm ups or anything that you do that you recommend to people to strengthen those surrounding muscles?
Absolutely. So any core strengthening exercises are fantastic. You know, people think of core just doing repetitive sit-ups. That's been shown that's actually not usually beneficial. Doing, you know, that they put a huge strain on the back. They do strengthen the abdominal muscles, but they can strain the back. But working on, you know, plank exercises, working on rotational stabilization and warm-ups when you warm up, making sure you're doing stretching exercises for your back and taking the time to really warm it up and stretch it, I think, is important. And then cross training. Swimming is a fantastic exercise for people who have low back problems, because you take the weight or the stress off of it, yet you're still working on your core and your mobility. And so all those things can be very helpful and beneficial to people who are struggling with back problems.
And with that, sit-ups are such a traditional activity. What are some alternatives to sit-ups that people can do to strengthen those abdominal muscles?
Yeah, and I'm not saying sit-ups can be very beneficial and great, but I think you have to do them ergonomically or physiologically in a good way where you're not straining the back. And so a lot of simple exercises where you're, instead of doing sit-ups where people can hold, you know, you're just laying down with your back against the ground and you can lift your feet off the ground and trying to sort of just keep the legs off the ground. You're still using your abs, you're still using your core. Plank exercises of different kinds are fantastic back core exercises that you are not putting that strain on your back, and they can be really beneficial. So those are some examples that you don't forcefully strain your back, yet still work on the core.
Yeah. Yeah. And also in more of the older player, the neck issue seems to be pretty common. Similar typing stretches, or what would you recommend?
Similar. It's a little more difficult. You don't have a core around your neck.
Right,
So
right.
really working on, motion flexibility, but also working on some of the stretching exercises. Sometimes physical therapists, I would only do this in a controlled environment, but they can sometimes use, gentle traction maneuvers to try to decompress the cervical spine. But these are things that certainly shouldn't be done without somebody overseeing them, such as a trained physical therapist, because they yeah, you can do more damage than good.
Excellent. Great. Well, great. That was extremely helpful for me personally, and I really hope everyone watching got a lot out of this, because that was incredible insight, and to be able to get this for free for everybody, it's unbelievable. And I'm really appreciative that you were able to jump on and provide all this information.
Yeah. No, thank you so much. I hope it had some value for our listeners. And I just wanted to mention, I think that this is going to be, this recording is going to be put on the Sports Medicine North website. And with it, I think we're going to try, our IT department's going to try to link some simple, tennis elbow, rotator cuff, Achilles stretching exercises where people can look and certainly see them. And obviously, at any point, if there's any questions, they can see one of our partners or any of our team to try to get further evaluated and informed.
Excellent. Great. And I'll put you on the spot really quick. Who's your French Open pick?
Who do I want, or who do I think?
Either way.
I would love Rafa to win.
Yeah, that would be amazing, huh?
That would be amazing. I don't think. I hope he's got it still.
Yeah. Was he kind of your, in the big three? Was he your go-to, or did you have someone else that you were a big fan of?
Between him and Federer, they've been amazing, right? And so watching them, and he's just such a fighter and has seems such a gracious and sort of positive person in every aspect of life, that how can you not like him? But I also think that the new generation is super exciting when you watch Yannick Sinner, you watch Alcaraz, you watch Zverev, you watch all these guys. I mean, they're incredible. Obviously Djokovic is amazing as well, but I don't know. For some reason Rafa is yeah.
That's great. Well, hey, that's your opinion. Everyone's got their own opinion. You got to respect that, and you got to love it. Great. And last question before we let you go and let everyone go. Being an elite athlete growing up, playing soccer, how later in life did you end up transitioning to tennis, and what's that transition been like for you?
I honestly first of all, elite athlete, thank you for that. But I played soccer up until last year and miss it. And I just, as I stopped playing because everything hurt too much, I sort of just transitioned over the last year because I needed to fill a void. And I had played for fun and with friends growing up and never in an organized manner. And this is by far the most organized that I've sort of played it. And I love it because it's competitive, it's social, it's it's a good workout, and as I said before, I think it gives me a little bit more control where people are not hunting me down and trying to tackle me as it was during the soccer games. So I take at least one injury variable out of it.
Beautiful. That's great. Well, great advice. So thanks again, Dr. Zoric. We really appreciate it. We hope everyone had a great time, and look out for the link. We'll be sending the link. We'll have some stretching, some exercises from you on the website.
Great. And, thank you for having me. Much appreciated.
Of course. Great.
Take care.
Thank you again, everyone.
All right.
Appreciate it.